It all started in spring of 2015 when we realized at WVU Medicine that we wanted to create signature programs at our hospital so that we would begin our journey to being subspecialized. And one of the top programs was the Heart and Vascular Institute. We started with our recruitment and knew that we wanted to have a world-class Heart and Vascular Institute. And we hired amazing surgeons and physicians over the first 18 months. And what we realized is then we needed to add the place. And so the vision of building a Heart and Vascular Institute quickly came to life.
Our goals were really to have the most functional room no matter what case needed to go in there. So the hybrid rooms that we built with Philips technology, they have the FlexMove technology with integrated Mackay beds. This allows us to utilize those rooms for anything, whether it be a standard open operation, a hybrid procedure, an advanced endovascular procedure, or even a cardiac surgical procedure.
When we chose the Philips, we were looking for several things. The first being high quality care. And Philips provided us with that superior platform so that we could have great outcomes for our patients. But we also wanted to look in a system that was very efficient.
And with Philips and how easy it is to use, helps us, immensely, obviously, because we do 7 or 8, 9 angiograms in a day. Some places, that's a 12, 14-hour day, and then with our case, it's 8, 9.
Speed is important, but only tied with high quality. And also ranking most important was the reliability of the system which we chose, and the consistency. We looked at safety features and the zero dose radiation when you're positioning a patient, the clarity with the imaging, getting the best imaging with low dosing, which is safer for our faculty, for our surgeons, for our staff that are in the room, the nurses and the techs, has always been something that's been highly desirable for our team. Because as we move more and more to a minimally invasive platform, we're doing more and more with imaging. At the same time, we needed the versatility to pick a system that would service our structural heart program, which was just in its infancy, to be able to do minimally invasive aortic valve and mitral valve work. And so we needed a system that not only served the vascular surgeons, but also the cardiologist. And then traditionally, we still wanted to be able to do open procedures in the room with our vascular surgeons and our heart surgeons if need be. So having 3 hybrid operating rooms allows us to have flexibility with whatever the demands are of the day. So certainly what we've seen is our staff love the Azurian. They found that it's easy. They feel like they're working in a world-class institution, which certainly helps us from a recruitment and retention standpoint, also with our surgeons, which sometimes is sort of lost in the financial view of we sort of look at the revenue that the procedures bring in. Also, the ability to efficiently complete the cases. So with the Philips system, we can better prepare on the front end and greater efficiency during the case and afterwards. And one of the items is the surgeons love being able to work table side.
Well, I'm not waiting for someone to bring up a particular image or bring up a table position. I can do it all myself. And who knows better what I want to see than myself. So I don't have to waste time expressing to a tech, this is what I want to see, this is what I'm looking for. I can do it all myself. Meanwhile, the tech can be in the back in the control room. They can be working in parallel, such as working on the next patient, bringing up the next procedure card, or they can be reprocessing images for final storage on the current patient. They can do almost anything they want back there.
And so you're not constantly running back and forth between the control room and table side. So we're able to decrease our times, not only the prep time, the post time, but also the actual procedure time, which allows us to do more patients throughout the course of a day. It's also financially helped us grow programs that we traditionally had very little of or didn't have at all, such as our TAVR structural heart program for aortic valve repair, but we also launched the Tendyne, the mitral valve trial here with the Philips Azurian system. And it's also helped us bring in lots of other cutting edge trials that we can be first to start with these new procedures, and then hopefully as they come to life, continue on with that care. So it's been very beneficial to us. They loved the training. The Philips team actually took them to a place that's been using not exactly the Azorian, because we were first in the United States to get this model, but the other Philips equivalents to this. And so they felt very supported.
From a surgical perspective, I hired 2 new surgeons, neither of which had utilized Philips technology in their training. They were able to adapt to Philips technology, and it didn't take them more than a week to become very, very familiar with the functionalities and comfortable utilizing the table. From a staff turnover, meaning techs, radiology technologists, we have had turnover, and the new staff has found it very, very easy to utilize the equipment.
The Flex Move allows us to have the unit, if we need imaging, right there where we need it. We can pan the patient and anticipate our next move of how we're going to position the patient without causing radiation exposure to the patient or anyone that's on the team. But also at the beginning of the case, the end of the case, when we're cleaning the room, the Flex Move can be parked totally out of the way. And so anesthesia can get to the patient for induction. We can open the sterile field. We can clean up afterwards. We can easily move the patient back onto their own bed and not even know that the Azorian is even in the room because of the ability and its versatility and its flexibility. And then from a cleaning perspective, there's not cords hanging everywhere. So it fits in with our laminar flow so we can keep sterility, but it's all contained and there's not a lot to wipe down, there's not a lot to dust. Vascular surgery has a high rate of inpatient add-on cases. Some of them might be open, some of them might be endovascular. We also have a high rate of cardiac surgery cases that can be structural heart. Being the only level 1 trauma center in the flagship hospital for the entire state of West Virginia, we have a lot of patients who are shipped to us as a destination site. So we need that constant flexibility between the regular traditional OR, the ability to do endovascular procedures, the ability to convert that to an open case or plan an open case, and having 3 of these sort of limits the ability you see when you have 1, that if a trauma comes in, we can take that trauma into the room, not disrupt the other 2 rooms, not disrupt the patient's schedule or the ability to even get a patient done that day, which also helps on our inpatient length of stay. The future of healthcare, the future of the Heart and Vascular Institute at WVU Medicine is more and more based on what we call value-based healthcare. And I think as we drive quality, we must stay at the top of our game, from doing the most advanced procedures in the most efficient manner and the most cost-effective manner, because truly quality and cost equal value. And I think the Azorian unit is positioning us well as new procedures come down the line that have traditionally been done in an open fashion that we can do from an endovascular or a structural heart perspective, that this unit will serve us for years to come in being able to provide that need, not only to the citizens of West Virginia, but beyond.